intrafusal muscle fibers. The middle part is not contractile, the two ends are contractile. They receive gamma innervation, right? A gamma innervation. But the thing that I want to add is that there are two types of intrafusal muscle fibers. They are not all the same. Okay? Some of the intrafusal fibers have their nuclei in the middle part, in a central area. We call them nuclear back fibers. So the middle part is something like a backbone, right? Other type of intrafusal muscle fibers are called nuclear chain fibers. So their nuclei are sequenced or are arranged in a row, in a chain, right? So nuclear chain fiber, nuclear back fibers. They are structurally different and they also have different functions. Nuclear back fibers are mainly involved in dynamic response. I will talk about that. Dynamic response. Nuclear chain fibers are involved in static response. Okay? You should memorize this. Dynamic response, static response. Now let's see the innervation again. I told you that they receive 1A fibers and 2 fibers, right? Now let's see the innervation. 1A fiber divides into 2 branches and innervates both of them. Nuclear back, nuclear chain fibers. But group 2 fibers mainly innervate nuclear chain fibers. Right? So, static response can be conveyed through group 2 and group 1A fibers. Chain fibers generate the static response. The action potential is conveyed through 1A fibers and 2 fibers. But dynamic response from the nuclear back only is transmitted through 1A fibers. From another view, 1A fibers carries both dynamic response from nuclear back fibers and static response from nuclear chain. But group 2 fibers can only convey static response from chain. Did you get this? So now let's see what's the difference between static and dynamic response. Actually, you know that because you are familiar with rapidly adapting receptors and slowly adapting receptors, right? Yes. So we have stimulus here. Stimulus is stretch of the muscle, right? So we stretch a muscle and then hold it, right? So we increase the length and then keep it constant, right? Dynamic response is action potentials that are generated during the stretch, when the stretch is on progress. But static response is the action potentials that are made when the stretch is ended, is constant, right? So, increase in the firing rate during the stretch is called dynamic response. Increase in the firing rate that happens during the constant stretch is called static response. So, a group 1A receptor that sends both dynamic response and a static response behave like this. In the resting state, when there is no stretch, it sends some action potentials. During the stretch, it sends a lot of action potential. After the stretch, it sends more action potential than the resting, but fewer action potential than dynamic response, right? But group 2 fibers only respond to a static stretch, right? So, when you are stretching the muscle, they continue to fire a little more than the resting state. There is no difference between this phase and this phase in this receptor, right? So muscle spindle has two types of fibers, 1A and 1A fiber has both dynamic response and static response. But group 2 has only static response. Now let's see another type of stimulation. Tap, like knee-jerk movement. Okay? You have a sudden increase, sudden stretch, which is very transient and brief. Right? So what happens during the stretch? Type 1A fibers sense some action potential during the tap, and then they end the action potential after the tap. After some milliseconds, the resting state comes back. Right? What happens in the type 2 fiber? Almost nothing. So, with the tap stretch, the only type of fiber that responds is 1A fiber. Type 2 fiber from the muscle spindle doesn't respond. So, this means when you are examining a patient with knee-jerk reflex, you are examining the dynamic part of the reflex. The static part is not examined. Right? Another thing. Sinusoidal stretch. So, you will have action potentials only in some of the phases of the stretch, not in all parts, okay? And type 2 fiber doesn't respond. So, then you have changing stimulation. For example, you may stretch a muscle, so the length is changing. When you have tap, that change happens very briefly. Or you have sinusoidal stretch, right? So you have change of the length. Type 1A fiber responds, but type 2 fiber doesn't respond. When you have constant stretch, then both of these can respond, right? So this is the differences between static response and dynamic response. Now, let's see the results. Okay, muscle spindles can send two types of information to the spinal cord. Spinal cord receives the information and sends the motor response to the muscle, right? So contraction of the muscle can happen dynamically or statically, right? So dynamic stretch response or reflex is like this. Rapid stretch causes dynamic signals by 1A and B, which causes instantaneous and strong reflex, right? But it's over within a fraction of a second. Everything happens transient. Then, quicker. Static stretch reflex continues for a prolonged period. This happens because of the action of the 1A and 2A that cause constant muscle contraction. So a stretch reflex has two components, a dynamic component, which happens very fast, and for a very short duration, right? And a second component, which is called static, that happens after a delay, but it's more prolonged, right? And happens constantly. The second component is by way of 1A and 2 fibers, but the first component is by way of 1A fibers. So, if you have a question like this, which part or which of these is not involved in the knee-jerk reflex? Static what? Okay. One A, sensory fiber. One B, sensory fiber. Nuclear back fiber. Alpha motor neuron. Which one is not involved in the knee-jerk reflex?
B.
B is the answer. Why not C?
It is dynamic.
Yeah. So knee-jerk reflex is a dynamic part, is a dynamic reflex, right? Nuclear back fibers are the origin of the dynamic reflex. So they are involved, for sure. What about D?
It's a return.
So it returns the signal from the spinal cord to the muscle, no matter if the reflex is dynamic or static. For both of them, we need it. Because contraction of the muscle occurs by way of alpha. So we need alpha too. Right? Good. So I may ask you something more difficult. Now, which one is the answer? Which one is the best answer? Which one is not involved in knee-jerk reflex? Again B?
Yes.
Yes? Yes. But why?
Sometimes the fibers, when it goes to dorsal, it can directly snap with the alpha motor neuron, not with the anterior one. For the
That was for voluntary movement. When the descending fiber comes to the spinal cord and makes synapses with the anterior motor neuron. But now we are talking about the reflex. So you know the answer, it's B, I know. But you should have an explanation for that. Why B? Are spinal cord interneurons, are not involved?
Involved.
They are involved? No? Why?
It's because the spinal cord itself has the capability of for the lower limbs. It can take the action. It does not need any motor fibers for
I think it's
interneuron connection.
It's a dynamic response, so it's carried by one A fiber. I think if there was a two fiber, then they're involved in interneurons.
Yeah, so maybe somehow. Actually, this is not a very good question, but I told you that for dynamic response, we need 1A fibers. 1A fibers go to the spinal cord and they can directly make synaptic alpha. So there is no need for interneuron. But type 2 fibers go to the spinal cord Then they make synapses with alpha motor neurons, with interneurons, and interneurons activate alpha motor neurons. That's why we have more delay, right? So, actually this is not a very good question because there is a problem with that. You know why? Because interneurons are not involved directly for activation of the muscle, but they are involved for inhibition of the antagonist muscles. Right? Okay. So, but it was very good question for challenging your mind, you know? Okay.
Ne Abbas? Chair बोले ना वो भांग क्यों फिर? ये बहुत
Okay.
हर फोन है दोनों.
Problem?
Cheers.
Chair problem.
Chair. Problem is chair. Don't you remove
It is disturbing you, sir.
Okay, so muscle spindles receive motor innervation through gamma motor neurons, right? I told you that they can contract the two ends, and this way they can activate the middle part, so they start firing after the contraction, okay? So, gamma motor neurons can be also divided into static and dynamic. So we have both static gamma and dynamic gamma. Dynamic gamma excites nuclear back fibers mainly, so they increase the dynamic response. Static gamma activates nuclear chain fibers, they enhance static response. So, remember I told you that you may have stimulation like this, right? What is the response of the 1A fiber? During the stretch, you have more action potential, right? After the stretch, we have slower rate of action potential. So we call this dynamic response, this one, static response. But before that, we have also some action potentials in the resting state. Remember? So let's calculate the dynamic response here. Imagine that we have 3 action potential per second here, 10 action potential per second here, and let's say 5 action potential per second here. Okay? So, how can we calculate the dynamic response? 10 minus 3, right? So, 10 minus 3 is a dynamic response, 7. 5 minus 3 is static response, right? So static response is 2 action potential per second, dynamic response is 7 action potential per second. Now, I told you that gamma dynamic increases the dynamic response. So, if gamma D is activated, then this response increases. Maybe you have, instead of 10 action potential, for example, 12 action potential. So the result will be 9. So there is an increase in the dynamic response without any change in the static response. Right? If gamma static neurons are activated, then the dynamic part remains steady, remains the same, but the static part increases. For example, it goes up from 5 to maybe 7. So that the static response will be 4 instead of 2. Okay? So, gamma dynamic increases the dynamic response. Gamma static increases static response. Right? Okay. Gamma neurons are regulated by a center in the brain called bulboreticular facilitator region. It's located in the pons, in the reticular formation. Okay? In the reticular formation of the pons, we have a region that activates gamma motor neurons. The pathway is reticulospinal. So, pontine reticulospinal tract sends information to the gamma motor neurons, and they can activate gamma motor neurons, right? When gamma neurons are activated, muscle spindles become more sensitive. So gamma neurons regulate the sensitivity of the muscle spindle, right? So, the same area, bulboreticular, is controlled by cerebellum, vestibular nuclei, basal ganglia, cortex. So these areas control the bulboreticular facilitator region, and this area controls gamma motor neurons. So descending pathways excite gamma motor neurons excite muscle spindle, firing rate in 1A and 2 fibers increases, right? The action potentials go to the spinal cord, then they come back again to the muscle. They cause partial contraction in the muscle, which is called tone of the muscle. Did you get this? Tone of the muscle is partial contraction that we have in our muscles when we don't move, when we don't have any active contraction. So if you touch your muscle, it's not so loose, okay? And it's not contracting also. But you feel some degree of stiffness. We call this tone of the muscle. It's because of the partial contraction that we have in our muscle. This tone is generated by the action of the gamma motor neurons. Actually, alpha motor neurons are also involved. But some part is made by gamma motor neurons. So, reticular formation of the pons. Send the information to the gamma motor neurons. Gamma motor neurons activate muscle spindles. Muscle spindles send action potential to spinal cord. Alpha motor neurons come back to the muscle, activate the muscle. So we have partial contraction in the muscles, which is called tone. Right? Another importance of the gamma motor neurons is the maintenance of the posture. Okay, so posture can be controlled by gamma motor neurons. For example, any change in posture can be detected by muscle spindles. I mean. So, a soldier which is standing up and listening to the commander, general, I mean, okay? Maybe they need to stand up for 2 or 3 hours. I don't know if you have any experience or not. Okay? So after a while, they become tired and they may lose their balance. Okay? For example, they go backward, this, for example. Okay? So when they actually lose their balance backward, what happens? Some muscles are stretched. For example, I feel a stretch in my trunk muscles and also here. Okay? So, there is a sudden stretch in the muscle. What's the result? Stretch reflex. Right? Stretch reflex causes contraction of the same muscles. So, there will be a correction in the situation. Okay? So, any deviation from the normal balance can activate both the internal ears and the vestibular system, and also may activate directly the stretch reflex. So stretch reflex may help maintaining the posture. Okay? Did you get? Good. Another reflex. Golgi tendon reflex. It says severe contraction of a muscle causes relaxation. It's totally opposite to the stretch reflex. In the stretch reflex, you stretch the muscle contracts. Here, muscle contracts strongly, the result is relaxation. It's a protective mechanism, protective reflex. It actually prevents fracturing the bone or rupturing the muscle or rupture of the tendon. Okay? It stops very strong contraction. So, the receptor for this reflex is Golgi tendon organ called GTO. Okay? Muscle spindle was in the belly of the muscle. But GTOs are in the junction of the muscle and the tendon. Right? Here. The relation between the muscle spindle and muscle fibers was parallel. But here the relation is serial. So we have muscle fibers that are connected to the tendon, and at this junction we have Golgi tendon organ. So receptor is connected to the muscle fibers by a serial attachment. Right? So contraction of the muscle stretches the tendon. Right? Inside the Golgi tendon organ we have several fibers of collagen. And a nerve coming to the receptor branches several times. The nerve tips are between these collagen fibers. So contraction stretches the collagen. They become tight, right? And they press on the nerve tip. This way they can activate the receptor. The type of the fiber which innervate the Golgi tendon organ is 1B. Okay? 1A was for muscle spindle, 1B is for Golgi tendon organ. Okay, it goes to the spinal cord, it activates an interneuron which is inhibitory. We call this 1B inhibitory interneuron. 1B inhibitory interneuron. The inhibitory interneuron inhibits the alpha motor neuron that innervate the same muscle. So the same muscle that contracts is relaxed because of the action of this interneuron. So in this reflex, we have 3 neurons in succession. 1B inhibitory interneuron, alpha. Right?
Yes.
Okay. So, GTO responds to tension or force of the muscle. We have both dynamic response and static response also here. Right? Another reflex is the withdrawal reflex. So, if you touch something very hot, you return your hand. You bring your hand back, sorry, okay? So, we call this withdrawal, okay? Sometimes we call this flexor reflex because you need contraction of the flexors. Flexors are contracted, so the limb gets away from the painful object, right? So flexor reflex is another name for withdrawal reflex. A strong cutaneous stimulation to the limb causes flexion and withdrawal of the limb, extension of the opposite limb. Let's see here. So, for example, nociceptors in the hand are activated by a hot object. They send information to the spinal cord. They activate a population of interneurons, right? Interneurons activate alpha motor neuron to the flexor, inhibit alpha motor neuron to extensor. So flexor muscle contracts, extensor relaxes.
Yes.
Result is flexion. Flexion means going away from the object,
Yes.
right? But Some other interneurons go to the opposite side, activate another population of interneurons. These neurons cause an opposite pattern of activity on the opposite side. So they relax, flexor, contract, extend. So extensors contract, flexors are relaxed. Why do we need this? So, for example, if you have pain in your leg, I mean sudden pain, right? You will do flexor reflex. Okay? It means your weight should be kept by another leg. So, for keeping the weight, we need extension. So, extensors are contracted, flexors are relaxed. Right? We call this cross extensor reflex. So, by painful stimulation, we will have flexor reflex on the same side, cross extensor reflex on the other side. Depending on the strength of the painful stimulation, other limbs may get involved. For example, sometimes you touch something which is painful but not so painful. Okay? You remove your hand like this. But sometimes it's so strong and so painful that you withdraw your hand and also go away from the object. Okay? And all of this happens suddenly and automatically without thinking. Okay? So, withdrawal reflex from the hand spreads to legs and also to the body. How this may happen? Propriospinal neurons. Remember? I told you that we have segmental orientation and propriospinal orientation.
Do not go opposite sides.
Yeah. So, one segment get involved in the reflex, but fibers from here goes upward and they activate also alpha motor neurons that go to the arms. So arm is also involved. Or maybe the arm senses the pain, then the movement spreads to the leg by way of propriospinal neurons. Okay. Now we can start brainstem. Okay. You want break?
No.
Answer? Question? Okay, no problem. But your midterm exam is until to this slide. Okay. So after this one is for your final exam.